Why is my blood sugar still high when I've stopped having sugary drinks? I've stopped eating stuff that have processed sugars. I've stopped adding sugar to my tea or coffee or milk or whatever. Why is my sugar still high? This is what a patient asked me during a routine visit. And this patient has had high blood sugar or diabetes for a very long time. They are on medications in addition to insulin. And during a routine visit, I was going over their labs and I was explaining to them that their average blood sugar over the past 3 months compared to when they saw me the last time has increased. And that's when they asked that question. A lot of times we think that if we stop eating sugar or stop having processed sugar compared to what we used to have, our blood sugars will return to normal or we'll stop having diabetes. But this is not the case for most patients. Some patients who are probably newly diagnosed, patients who routinely go to their doctor, they routinely have follow-ups, and they're diagnosed with early stages of diabetes. Stopping some things can bring their blood sugar back to normal and lead to where they don't even need medications. But if you're someone who have had high blood sugar or diabetes for, you have had full-blown diabetes, you're dependent on medications in addition to insulin, meaning you are now insulin dependent diabetic, it's hard to just reverse it by stopping a few things. A few lifestyle adjustments can help keep the blood sugar from fluctuating a lot. But overall, there are a lot of steps that are need to be taken to reverse high blood sugar. Now, back to my patient. They have stopped eating sugary foods, they stopped adding sugar to their drinks, and so on and so forth. However, their blood sugar over the past 3 months increased. What could be the reason? So my patient thought that their blood sugar was as a result of them eating sugar. I needed to explain to them that diabetes or high blood sugar is not as a result of eating too much sugar. Diabetes is a disease process or a disorder where your body can no longer process sugars the way it usually would. Therefore, if you eat more sugar containing foods, it increases your blood sugar because your body doesn't know what to do with all this sugar. And the cause of diabetes is different for every patient. Not everyone have the same cause of diabetes. And in most cases, we don't even know the causative factor. We know contributing factors such as you eating a lot of sugar containing foods or sugar containing drinks. That can contribute to your blood sugar going up. That can contribute to you having diabetes. But we don't know that it caused it. There's a difference. Some people are predisposed based on certain medications that they are on, or family history, or sedentary lifestyle, or other comorbidities. Comorbidities are other illnesses that you have that can contribute to you developing another illness. So for example, somebody who have hypertension, high cholesterol, might develop diabetes. They have a higher chance of developing diabetes than someone who does not have those diseases. If you're a healthy adult, you don't have any health condition, whatever your parents have, whatever chronic conditions your parents have, put you at an increased risk of developing that down the road. If you know, for example, if I know that I am at a higher risk of developing diabetes because one or both of my parents have it or a sibling has it, then I can take steps to decrease my risk, right? So in general, once you're already diagnosed with diabetes, and you're on medication, particularly if you're dependent on insulin, for most patients, it's hard to reverse that unless they take drastic changes or they make drastic changes to their lifestyle. Meaning, if you are someone who drinks alcohol, you stop drinking alcohol. If you're someone who lives a sedentary lifestyle, you stop sitting around and start moving your body. If you're someone who ate whatever you want it, whenever you want it, you can manage your diet better. If you're someone who ate more carbohydrates, fried food, and processed food, you could switch to, or maybe add healthier options such as fresh produce to your diet. That can help significantly. In most cases, it'll help decrease or delay the progression of the disease. It might not necessarily reverse it, but for some people who take drastic measures, it can be reversible. Now, let me paint a picture for you. If you are diagnosed with diabetes and you also have heart disease and you also have lung disease, what are the chances that you can reverse your chronic diabetes? They are slimmer compared to someone who is healthy or who is healthier and not have those other comorbidities. The reason that I mentioned heart disease and lung disease is because one of the primary things that you can do to reverse diabetes is physical activity. For someone who has lung disease and has heart disease, such as heart failure or COPD or chronic respiratory disease, they are not able to do endurance activity for prolonged periods of time because of their comorbidity, because of the other health conditions. So that will limit how much they can walk, how far they can walk, how they might not be able to run at all, depending on the stages of those diseases. So there are a lot of factors that contribute to whether or not you can reverse this disease. I've had cases where patients would take an extra dose of their insulin or their as needed dose just so they can eat whatever you want. Please, if you're such a patient or you're a family member of a patient who does that, advise them to stop. Because when you do not stick to your medication regimen because you have the extra room or the wiggle room to take more medicine and you just eat whatever you want, guess what? You're not helping yourself. You are doing more harm than good, because when your blood sugar is elevated, it doesn't only affect your numbers, right? It affects other organs in your body. It affects how your heart pushes blood throughout your body. Because if blood cannot get to where it needs to go, that part of your body is depleted of oxygenated blood, and it can tend to die or become weaker and bust open. And insulin, because that extra dose of insulin might bring your sugar lower for the moment, but on average your blood sugar will be higher than where you would want it to be, or where your healthcare provider would want it to be. I'm just here to encourage you that stopping sugars and stopping sugary drinks or sugary snacks are not enough, but they're definitely a good step. They're not enough to normalize your blood sugars if you're a diabetic. They are definitely a step in the right direction. So if you're doing that, keep doing it, and understand that your blood sugar is high, not because you're eating too much sugar alone, but it's because your body has lost its, or has a decreased capacity to process the sugar you eat. Also keep in mind that the sugar doesn't, your increased sugar is not only as a result of sugary stuff that you consume. So the thing you eat doesn't necessarily need to be sweet for your sugar to go up. If you eat wheat bread, it could still make your blood sugar go up, although it's not sweet, right? So sugar is carbohydrates. Your body breaks it down. The one you add to your tea has already been broken down outside of your body. But when you eat foods, every single food group contains some level of sugar. Keep that in mind. Follow this channel, like, and let me know in the comment section what you like us to talk about.